Today, we will briefly discuss the homeopathic medicine Abrotenum. The main important symptoms of Abrotenum are alternating or transforming diseases, patients feel better during diarrhea, emaciation despite intense hunger, talkativeness, etc. Kent said this a very valuable remedy should be more frequently used. It is indicated in such conditions as are cured by Bryonia and Rhus, but its symptoms mark out its own individual cases. Okay, we will explain why Kent said that. Let's explain with an example. The important keynote symptoms of Abrotanum are emaciation, especially of the legs, rheumatic pains, metastasis, irritability, especially in the children, and suppressed discharges. For example, a child with severe emaciation of the legs, a large abdomen, a history of suppressed diarrhea, the child is irritable and restless with shifting rheumatic pains. Then we will think Abrotenum medicine. Again, the important keynote symptoms of Bryonia are dryness of mucous membranes, stitching, tearing pains, pores from motion, and better from rest, thirst for large quantities of cold water, and irritability. Example, a person with dry hacking cough, stitching pains in the chest, worsened by any movement, and strong thirst for cold water. He is irritable and wants to be left alone. In this condition, we will think bryonia. On the other hand, the important keynote symptoms of Rhus are restlessness, pain relieved by motion, but worse on initial movement, stiffness, symptoms worse in damp, cold weather, and triangular red tip of tongue. Example, a person with rheumatic pains that are very stiff and painful on fast movement, he is restless, constantly changing position, and their symptoms worsen in damp weather. Then we will use Rhus medicine. Here we see that above 3 can be used for rheumatic pains, but Abrotenum's pain are often shifting and associated with emaciation and suppressed discharges. At Bryonia, the pains are stitching and worse from any motion, relieved by absolute rest. On the other hand, Rhus pain are stiff and worse on initial motion, that improving with continued motion. Let's see another example. Imagine a patient with joint pain. If the patient has joint pain that shifts from one joint to another, along with significant weight loss in the legs and history of suppressed skin eruptions, then Abrotanum would be considered. If the patient has joint pain that is sharp and stabbing, worsened by even the slightest movement, and they have a dry mouth and intense thirst, then Bryonia would be considered. If the patient has joint pain that is very stiff in the morning, improving after they move around for a while, and they feel worse in damp weather, then Rhus would be considered. In essence, Kent emphasizes that homeopathy is not just about treating the disease, but about treating the individual patient and their unique symptom picture. The shared symptoms provide a starting point, but the individualizing characteristics lead to the correct remedy.